My name is Muhammad Izzuan bin Rashid. Would like to present about introduction. So, the name dengue comes from the Swahili word Kidingapipo. In Spanish, written documents from the 1800, the first account of a disease known as dengue can be found. The word dengue or dengue was also used to describe the disease. The Spanish word dengue did not become widely used until after the 1828 epidemic in Cuba, and now it is still used today. Dengue virus and arbovirus spread by the mosquitoes. This virus can spread through the different vector which is by the mosquitoes by the different species. The extreme type of dengue, which is dengue hemorrhagic fever, was first reported in Thailand and the Philippines. Following that, the extreme form of the dengue fever spread across the Southeast Asia and eventually around the world. Dengue epidemic in the northern state of Penang, and it was the first case recorded in Malaya.
So the objectives of this PVL report is to investigate the type of disease and its method of transmission, and secondly, to study the preventive measures to be taken in order to prevent the outbreak of the disease and in order to prepare a campaign to educate locals on the outbreak. So based on the PVL report, the outbreak of the disease is believed to be cases of dengue fever. Dengue fever is a vector-borne disease which mosquitoes as its vector. Symptoms are high-grade fever, headache, rash, itching and muscle joint pains, while more serious symptoms are mouth and nose bleeding, vomiting, diarrhea, gastrointestinal bleeding, altered consciousness, and seizures. Symptoms worsen during second infection, which leads to bleeding. The symptoms for dengue fever actually matches with the symptoms in the report of the disease in Thailand. So during the second infection, the body will have more severe immunological response towards the pathogens. It is not possible for the human body to build up immunity toward dengue virus, as it has 4 other serotypes of dengue virus, where recovery from one of these serotypes does not mean complete immunity against the other 3. Dengue happens in a lot of tropical and subtropical countries, which further proves the disease outbreak in Thailand is dengue fever, as it has a tropical and humid climate where insects such as mosquitoes thrive in.
For my part in discussion is the transmission. So we know that dengue fever is caused by the female mosquitoes. There are 3 types of transmission, which is mosquito to human transmission, human to mosquito transmission, and other transmission. Okay, first of all, for the mosquito to human transmission, male and female mosquitoes get their energy from the plant nectar, fruits, and the plant sugars. However, female mosquitoes need blood to lay their eggs. So, when the virus is spread to humans by the bite of the infected female mosquitoes, especially the Aedes aegypti mosquitoes, it is not a mosquito to human transmission.
Okay, so now I'll present about the human to mosquito transmission of the dengue disease. So as we all know, dengue is not airborne, so it cannot be passed from one human to another. A person infected with dengue fever, however, can transmit this disease to other mosquitoes. During the stage where the virus circulates and reproduces in the bloodstream, humans have been known to bring this infection from one region or place to another. When a mosquito bites a patient at the stage of viremia, which is 3 to 5 days after being infected, the pathogen is transmitted to the mosquito's gut and saliva. Then, a newly infected mosquito may infect others for the rest of their lives. Since the dengue virus is spread by a sedentary vector, people's movements causes them to encounter mosquitoes at their homes and other places that they visit. Henceforth, the dengue virus is now transmitted in a human to mosquito to human cycle.
Okay, For the other transmission, dengue may also spread through organ transmission or blood transfusion from infected donor in some cases. There's also proof that a dengue-infected pregnant woman can pass the infection to their unborn child. So there's when a mother has a dengue virus infection while pregnant, her baby can born premature, have a low birth weight, and have a fetal discomfort.
Hi, my name is Hani Sakina binti Hilmi and my matrix number is FS20100192. Despite the danger of dengue outbreak, there are various preventions that can be practiced by the locals. First thing first, people need to avoid getting infection by preventing mosquito bites. Another way is to use insect repellents with EPA registered, which are proven safe and effective. People should follow the label instructions before they apply it to the skins. However, it is harmful for children under 3 years old if it contains OLE and PMD. Another point is the community should be advised to wear long-sleeved shirts and long pants to reduce the chances of getting bitten. As a precaution, treat items such as clothing with perfume sprays to kill the insects that touch the items. One thing that often overlooked is stagnant water. As a matter of fact, the Aedes mosquito often breeds in clear and stagnant water, such as in plant pot plates. Therefore, it should be cleaned up at least once a week. By far, there is no vaccine or medicine to cure dengue virus up until now. Therefore, if there is any symptoms of dengue, the person needs to see a healthcare provider to tell them about the travel history. Also, it is important for the infected person to get some rest and take paracetamol to control fever if needed. On the other hand, if the person has had dengue in the past, the person more likely to develop severe dengue. Therefore, the person needs to see a healthcare provider immediately to get medical care as soon as possible if there are any symptoms of severe dengue. That's all from me. Thank you.
So, for the conclusion, it is stated that the symptoms include the fever and muscle aches during the first infection and worsen during the second one, with bleeding as an additional symptom to this disease. It is believed that the main cause of these symptoms are most likely cases of dengue fever. An individual infected with dengue fever, on the other hand, may transmit the disease to other mosquitoes. The virus is transmitted through the mosquitoes' gut and saliva. There are various preventions that can be taken by the locals to prevent the spreading of dengue virus. That's all from us. Thank you.